Dr. Kevin Kavanagh, who is the president and founder of a national organization, Health Watch USA, also a retired physician himself, is with us now. Dr. Kavanagh, good morning.
Good morning, Jack.
Thank you. You're welcome. I'm sure you saw the president yesterday throw WHO under the bus, World Health Organization, and I know you are very much up to date on what they're doing, as well as the CDC and all others around the world. Do you think that criticism, did they deserve that criticism?
I think the criticism they definitely deserved. The timing is in question. You know, there's an old saying, you go to war with the army that you have, not the one that you want. In fact, last year at our Health Watch USA annual conference, we had the author of the book Deadly River, Dr. Ralph Friedrichs, and he talked about what happened in Haiti with the cholera epidemic, and the WHO is strongly implicated in actually having their workers starting the epidemic. There was a cover-up, and after that, there was also decreased resources provided to Haiti to recover. In fact, they still haven't received even a small fraction. Well, they received a small fraction, but very small, of the resources they were promised. So the WHO has a tainted history. They've done some very good things, but they've also done things that, well, are very questionable.
I know you know.
So being questioned like that by the president certainly is deserving. Whether you should do that in the middle of the epidemic where it is crucial we work with other nations, maybe not the best timing, and that's my main concern on that.
Okay. Now, I don't want to end up making this a political thing, but the next phase that we're going to be going through at whatever point, whether it's 3 weeks away or 3 months away, is going and getting the country back in business. And the White House has said that guidelines for restarting parts of the United States economy will be unveiled soon. Very important announcements from President Trump coming up in the next few days. What is your position on when and how, or do you have one?
Well, it's really not up to me. I mean, look, the airlines are still flying. Anybody can fly on an airplane that they want to. But if you go to the Louisville terminal and airport, it's virtually empty.
Right.
So the people are going to have to be made safe. Just because you open up a store doesn't mean people are going to go into it, and you certainly have no control over the virus. And this really does also bring up the topic of food processing and food safety. Mm-hmm. And as you know, Jack, one of the other big headlines were workers in meat processing plants coming down with the virus.
Right.
And we've talked about that before. For me, I buy processed foods, leave them out at room temperature for about 3 days, and if they're canned, cereals, etc., and then stock them on the shelves. If the food is refrigerated or frozen, contrary to what many people would think, that does not kill the virus. It actually preserves it. So if you're having frozen meats, I would be very careful in handling it. Make sure that it's cooked before you eat it, and wash your hands after you handle it. And those would be very important steps. We also talked about wearing masks when you go to grocery stores, and that food handlers should wear masks. And when I say food handlers, I include restaurants that are preparing my food for pickup. Mm-hmm. But Whole Foods now is requiring everybody to wear masks. I think that is a very good step to go to, and I think that other food services, grocery stores, etc., should also be requiring that. And also, we mentioned before last week that some states are starting to require that for everybody that goes into any sort of a retail establishment.
Yeah.
So this is a very infectious virus. And remember, wearing a mask is the DIY mask. It's not the N95s.
Right.
They're more intended to prevent you from spreading the virus than from you getting the virus.
Governor Cuomo last night or yesterday was quoted as saying, when restaurants open again, whenever that is, do not be surprised if your waiter is wearing gloves and even possibly a mask.
And I think that just reiterates what I had said.
Yeah.
That's when, personally, I would feel comfortable. Of course, as you know, I've concentrated on germs and bugs for a long time.
Yeah.
You can say I'm maybe overly concerned, but that's the way the country's going, too. So I think that's just safety.
Okay, so yesterday we learned in the governor's news conference that there are 2,210 cases in the state, 115 deaths. They show this slide that says if we stayed in isolation for 3 months and had great acceptance of that, we could see as few as 2,000 deaths, 115 deaths, even though every single one of them is a loved one, and it's not to diminish the importance of each individual, but that's pretty good so far, don't you think?
Well, it is pretty good. Our governor is doing a very good job. I wish people would quit hassling him with non-COVID related political items. As far as having his feet held to the fire for COVID-19, you need strong checks and balances on this. I think, openness, transparency, that is good. I know that one of the big debates is the primary election. Frankly, Jack, look, we all know that the Democrats are going to have Biden as their nominee. Republicans in at least this state definitely is going to have Trump as their nominee. So I think the primary emphasis on the primary needs to be voter safety. And personally, if they didn't have the primary and the party said these are our nominees, that would be fine with me.
Me too. Just get on with it, yeah.
Just get on with it and worry about the general. That's the important one. To argue about how people who are Democrats are going to be voting to elect Biden or Republicans to elect Trump, it's really a moot point. I think everybody knows that. And so I think the parties on both sides need to have some soul searching on whether or not they want to have poll workers exposed, people exposed, voting when they're really not set up for an alternative method of voting.
Always great to talk to you. Any other information you want to leave us with?
Well, that is it. Just stay tight, keep it home. Remember, I said a few months ago, or it seems like months, that this was probably going to be months. And once we get into the summer months, hopefully this will die down a bit. It may not. We'll just have to wait and see. But we will get through this. Fast testing is coming, and so is hopefully a vaccine.
Dr. Kevin Kavanagh, thank you, sir.
Thank you.